did you see that post?
People are talking.
Here's what's trending on the Rickey Smiley Morning Show.
Yesterday on social media, news broke about the tragic loss of our social media influencer and former Wild and Out member, Miss Jackie O. And I just so sad. I feel so bad for my friend DC Young Fly. Awesome young man. There was a beautiful couple. That was the mother of their 3 children. And we want everybody to keep him and his family lifted up in prayer this morning.
Yeah, as a mother, that was just so sad for me to see, and just really feeling for the family. So definitely, yes, Ricky, prayers going up. According to TMZ, Jackie made a post where she was in Miami to get a mommy makeover with Miami's Dr. Zach. Now, the official cause of death has not been released at this time, so this is just speculation so far. However, the story brought up the conversation on the concern and safety for women seeking cosmetic surgery and what the risks are.
All right, so joining us this morning from his Atlanta office, we have plastic surgeon Dr. Nicholas Jones. Good morning. Thank you for joining us today. Now, for those who may not, yes, sir, happy to have you. And for everybody that may not be familiar with cosmetic procedure terms, what exactly is a mommy makeover, and what are the potential risks to women?
Okay, so a mommy makeover is any combination of procedures that a woman may undergo, and typically is after your childbearing years, or after you've had your children, or you're older and you're just trying to get your body back to your younger years. And the most common combination is probably a breast procedure and something in the trunk. And so one, I would say the most common would be like an abdominoplasty or a tummy tuck, and like a breast augmentation. But there's so many different types of combinations. This is really curtailed to the individual patient.
So what causes complications, doctor, with cosmetic surgery? What's some of the things that causes complications?
So there are lots of things. So the first and foremost, it starts in the preoperative phase. So basically, as a patient, you want to make sure you inform your doctor of all your underlying medical conditions, any complications that you had with previous surgeries. And so that way your surgeon can decide what is safe for you. So in this specific case, it was very unfortunate, and obviously we don't know what happened. But when someone dies immediately or during the surgery or right after, there's a select few things. So it's like intraoperatively or on the table, I would say the most common reason would be anesthesia related. And that could be from, medications. Like, for example, there's certain medications that they use during surgeries, and some of them can cause an immediate drop in your blood pressure. So if you have underlying cardiac issues, it can lead to myocardial infarcts or heart attack. Other things include like pulmonary embolisms. And so basically what that would be is, let's say you develop a clot in your leg. The clot goes into your vena cava, or your large veins to your heart. It blocks the oxygenation of your lungs to the blood flow, and that can lead to death. And there's it really depends on what type of procedure you have. The longer the operation, the more likely you are to have complications. But I would say the most common cause of sudden death would be anesthesia-related, sudden cardiac event, or if you're having certain procedures, for example, if you're having a Brazilian butt lift and a fat is placed within the muscle, the fat can go into your venous system, and the fat can travel into your heart and cause an immediate blockage of the blood vessels, and that can lead to an immediate death.
Wait a minute, doctor. So if you're taking their own fat and putting it somewhere else, and the fat can get into the vein, how?
So the procedure is done carefully and by a certified, plastic surgeon. Is highly unlikely, but if the fat is placed below the muscle, so if you look at someone's butt, their skin, and underneath the skin is the subcutaneous tissue or the fat. So that is where the fat is supposed to go. When this procedure was initially started, the fat was being placed within the muscle. And so within the muscle are the vessels, the veins and the arteries. And so if you're putting fat under there blindly, you can injure those muscles. That can go into the vein. Vein goes into your vein. The fat travels to your heart. And while it's in the venous system, it's causing inflammation. The fat globules get mixed with your plasma, and it gets bigger and bigger, and eventually it can block off the pulmonary artery, which returns blood back to your lungs so it can become oxygenated. If that happens, immediate death can pursue.
Wow. Now, is there a screening process that you go through to determine if, a person should undergo plastic surgery?
Absolutely. So typically, for myself, what I do is I see all my patients prior to surgery, and things that I'm looking out for is previous cosmetic surgeries, if they've ever had any complications, if they have underlying medical conditions. There are, like, for example, let's say someone's had a surgery before and they had a problem related to an anesthetic agent they use. Rarely this happens, but there's this thing called malignant hyperthermia, where patients can have a deadly response to succinylcholine, which is an agent that we use to paralyze patients to put them to sleep, or like gases. So it's important to get all the information that you can from the patient so that you can make a more informed decision. And also you want to make sure you're at a certified facility where they use anesthesiologists as well as nurse anesthetists, and the facility has the proper equipment. So in the event that something does happen, you can respond appropriately and try to do what's best for the patient.
So, Dr. Jones, are men having cosmetic surgery as well? And if so, what type of surgeries are men having?
So, yeah, absolutely. So men are having surgery. I would say probably the most common is liposuction. Like, there's guys, even guys who work out, the older we get, we have pockets of fat or stubborn areas that need to be treated. I would say liposuction and abdominal sculpting, where we kind of highlight the underlying musculature to make them look more ripped up. But men get Botox, men get facelifts. I think, in today's times with social media, it's becoming more acceptable for men to get plastic surgery as well.
And real quick, we're talking to Dr. Jones, who's a cosmetic surgeon. And one thing we were wondering is so many people are going out of the country to get these procedures done. And you see things like, Tamika Raymond, Kanye West's mom, who had complications, and talk about, people who have lost their lives due to this. Why are people going out of the country to get these procedures done? And is it safe?
I would say several reasons. One, there's a poor education, a miseducation. Second is they think it's more affordable. It may be more affordable on the front end, but if you end up having a problem, it could be deadly. I think people should strongly reconsider, because when you go to another country, their standard of care isn't the same. You may not know who's operating on you. And then, like I said, the complications, that's the biggest thing. Like, I recently took care of someone who had surgery in Dominican Republic. And, there's great surgeons everywhere, but they had to fly her back, get her in the hospital. She could have died. Like, they perforated her stomach, and the cannula somehow got into her intestines. She was in the ICU for a long period of time. And I just don't think it's worth it. I think if you end up with a complication, you want to be somewhere where your family's near, and you're in a hospital where there are doctors who are certified who can take care of you.
Hey, thank you so much for taking out time out of your busy schedule to help us out and give us information. So if people have more questions, how can they follow you?
So I can be reached on my website, drnipandtuck.com. On all social media platforms is Dr. Nip and Tuck. And the phone number to my office is 404-777-TUCK, T-U-C-K.
All right, so to get that number one more time.
404-777-TUCK.
All right, thank you so much. Y'all give it up for Dr. Nicholas Jones, ladies and gentlemen. Hey, Gary.
Yes.
Hey, cut the music off, Dave. At some point on the show, I'm going to talk about the surgery that I had. I had a surgery just recently and stuff. And I don't want to say what it is on the air. Too personal.
Yeah, we don't want to talk.
One of those.
Yeah.
It didn't work, though, huh?
It did work. I replaced these nuts with some poo.